Essure is a newer option for permanent sterilization. In other words, in women who want to have their tubes tied, do not want any more children, it's a really great in-office way to do permanent sterilization. So the way that we traditionally do sterilization is either in the couple days after a woman has her baby, we do an incision in the belly button and bring the tubes up through that and cut them and tie them. Another option is to do it laparoscopically, which involves an incision in the abdomen. We look in with a camera and then burn, clip, put rings on the tubes, whatever way we do to just occlude or close the tubes. This newer way has really revolutionized the way that we can do sterilization procedures because it can be done in the office. You do not have to go to sleep for the procedure. Usually we give a Motrin type medication for pain control during the procedure, and that's done right when you come into the office for it. Essure is a metal coil that we place into the tubes, and it's placed by placing a camera through the uterus, through the cervix into the uterus. We visualize where the tubes start inside the uterus and just place the coils into each side. What those do is that over time they cause inflammation and cause scarring, and so the tubes are then closed. The difference with this type of sterilization procedure is that you do need birth control after it's done. So you need birth control for 3 months. At the end of that 3-month period, that scarring process should be complete, and we do a test called a hysterosalpingogram that looks to make sure the tubes are closed, which is always nice to know that you've got closed tubes. There's still a risk of failure, just like any type of birth control. There's about a less than 1 in 300 chance that you could become pregnant after an Essure, after a tubal ligation of any kind. So it's important that you still keep track of your cycles, but it's a very, very low risk that you'd ever get pregnant after that. And a lot of times this procedure can be done with just an office copay rather than having to do a hospital visit. If you choose Essure, you need to be sure that you never want to be able to have children again. It's permanent, not reversible.